Good afternoon, everyone. Just want to welcome everybody to our monthly webinar series, Freedom Requires Action. Every month we come together and try to talk about some of the policy issues, some of the things where really we need some regulatory change, some legislative change, some policy change to really enhance our ability to address human trafficking and various different issues. And so I'm really excited about the conversation that we're going to have today around interstate compact. And I think it's really interesting. I had just as sort of as a side comment to all of this, it was interesting as we were looking for presenters. You know, this is the Interstate Compact for the Protection of Children, or ICPC, is such a pivotal piece of not legislation, but pivotal policy, right? That really impacts how children are able to access services. But I found it so interesting that so many of the folks out there working in this space just really did not feel like they had the professional qualifications to speak on this particular issue. And so I think that just goes to show how important this conversation really is, because as those working in the space, whether we're directly involved in child protection through government agencies or working in the NGO space and providing relevant services, I think it really, shows that this is something that not only is somewhat problematic, if I could be so bold to say, but is also something that is very much misunderstood in there. So therefore, we're probably not addressing it the way that we really should be addressing it. I am so happy to be joined today with Laura Trent from the Safe House Project. Laura comes to us with years of experience, both, was starting in the corporate world with over 25 years working with C-level executives, drawing great strength and enjoyment and partnering with leaders to improve overall company efficiency and effectiveness. Laura graduated from Oglethorpe University with a bachelor's degree in business administration. She serves her local scout troop as a charter organization representative and co-chair of the parish council. And it's always been a dream to be able to use her gifts and talents to benefit those in the most desperate need. And so after spending most of her professional life working in a corporate environment, Laura considers it a privilege to be part of an organization that's changing the world in the most profound way. And I have to just sort of echo those sentiments that not only is Safe House changing the world in the most profound ways, but you are as well, Laura. It's been a privilege just to work alongside you these past couple of years and just see all the fantastic work that you're doing with survivor care. But before we really dive into this issue of ICPC, I wonder if you could talk a little bit about your role at Safe House Project and what that survivor support team is really working on day to day.
Of course. So, and I believe many people on the call know, Safe House Project does a long list of things in support of survivors of trafficking. We offer certification to programs to elevate the standard of care. We give grants out to programs where we're seeing gaps in the system. We also give out educational we offer educational webinars, but the placements team is where I can be found. And it's a national team. We respond to survivors in need either via our response line or via our website. Most of our calls come in from the survivors themselves. However, we do receive a great amount of calls from other hotlines, national hotlines, local hotlines. We interact with law enforcement, healthcare, social workers. And so when those calls come in, a member of our team will get to know the survivor, understand the need, really listen to what obstacles that individual is facing, and also listen to what compromises that individual is willing to make at that moment. And so then we reach out to one of our many partners to try and find out what availability we have across the nation. And then we'll go back to the survivor and talk through the options, always empowering them, of course, to make the decision. And so then we walk them through the application process and the interview process. And especially with kids involved, we like to get the children involved in that interview process. And I always tell children when I'm prepping them for an intake interview to say that this is you interviewing the program. This is not the program interviewing you. This is a beautiful way for us to see what that child is really looking for in an environment where they can thrive. And they ask the most amazing questions. They might ask things like, well, from my bedroom window, what will I see? Will I see a farm? Will I see a parking lot? Will I have to share a room? Can I have a night light because I'm afraid of the dark? Will you make me eat tuna fish? I hate tuna fish, And so we really get to know the child in a way that is so beautiful because it's so clear that even though this child has come to us with very adult experiences, they really do want a safe environment to be a kid again. And so then after we go through the interview process and the child is accepted, then that starts the ICPC process. Not all programs require an ICPC in the sending or receiving. So each state is a little bit different. And also each state is different on the age that an ICPC is needed. For example, I see some names on here of individuals that represent a state where their children who are in custody of state remain in the foster care system until they're 21. Most of the states, as you know, they remain until they're 18. So when we get to the ICPC process, we often run into roadblocks. Many of the programs out there don't even want to go there, right? Like we have beautiful programs that say, we don't take out of state. And so when I'm like, why don't you? What can I do, right, to help you to provide that service to children outside of your state? And they're like, oh, I've heard the ICPC process, it's too complicated. I don't want to wait and save this bed for 30 plus days so that a child may or may not fill it. So we do have a lot of programs that just don't even want to go there. And so then we also have programs open to it, but they're still overwhelmed about what to do next. So me and my team have really tried hard to understand the process, to know who to call, and to know what forms to fill out, and to know the timing that we should expect. And then, of course, once the ICPC is approved, then Safe House Project facilitates and funds the travel of the child, or if it's an adult, just the adult, but all of the children fly with a chaperone. And then we follow up with each placement, no matter what age, every 30, 60, 90 days to make sure that everything's going okay. And if it's not, that's okay. We get it. We'll work with that survivor and understand what the need is, what's going well, what's not going well, and then we place them again. We actually have some people, Bill, that have a 6 after their name in our system, and that means that we've placed them 6 times. And similar to the data that you've heard with a victim of domestic violence, so often we'll hear that individuals that are a victim of violence, whether it's physical violence or sexual violence, they will leave and go back, leave and go back, leave and go back, sometimes up to 7 times. And we know that. So whenever we get a call from someone who we've already placed before, we just welcome that call and say, okay, let's see what happened before, and let's try and make a more thoughtful and intentional placement in this next step.
Well, I think it's so beautiful. I mean, the work that you're doing, and we can clearly experience that to some extent today in your words on, it's really about the safety and well-being of the survivors that you're serving, and making sure that they have equitable access to quality care, right? Because we know there's lots of options out there. They're maybe not always the best options, right? And so I know as you work to kind of break down those barriers, as you mentioned, ICPC can sometimes be a little intimidating. It can create various challenges, but at the core of it, ICPC was created with a very noble purpose, right? It was created with the intent to really protect kids that were being moved across state lines, particularly those that were involved in the foster care system, involved in adoption or custodial disputes or whatever it may be. It was meant to ensure that, no child would really fall through the cracks simply because they crossed a border, because we have a very unique system here in the United States. And I think sometimes we take it for granted until we start to look at systems across the globe. But when somebody moves from state to state, right, some of those protections don't always transfer properly, or there's not that level of communication that's there. And I think that's one of the things that we're kind of seeing is that, unfortunately, while ICPC was designed to protect children, some of the bureaucratic inefficiencies or the lack of coordination between states have really created significant gaps in the system, right? And Laura, to your point, you know, the complexity of it and tying that in with the complexity of survivor care. You know, as you mentioned, you know, sometimes survivors need to be placed multiple times and need to be connected to various different services upwards of 6 times, which I think is so incredibly telling of what is really happening in this space. And so, you know, because of those gaps in the system, it can leave children in limbo, sometimes unprotected, sometimes exposed to risk, or sometimes unable to really access those services that they really need. So, Laura, I wonder if you could talk a little bit about maybe some of the specific case examples that you've encountered. You know, 1 or 2 examples where ICPC has either caused like harm or delay in placement of services that maybe you felt like, from your professional perspective, if there were some changes around policy, it would not have caused those same issues.
Of course. Well, one example I'd love to share with, just to show that even though, as you said, the objectives of the ICPC, I mean, are noble, right? To ensure the safeguard the interests of the child, to define responsibilities of all parties, and to clarify those responsibilities of who's in charge, right? But what I have found is so many inefficiencies in the process. For example, I helped place a child, received an approved ICPC. We arranged for the child and chaperone to travel to the program. And shortly after the child arrived, she eloped. And so she was found by law enforcement, brought to the hospital, child services stepped in. And shortly after that, I received a call, and child services was asking me what my involvement in the case was. And the social worker said, this child is in our state and not lawfully in our state because there's no ICPC on file. And I said, well, there is, because I have it. And she goes, well, can you send it to me? And I thought, well, that's interesting. Why don't you have it? Right? Like, if the whole purpose is to have a clear understanding of Jane Doe leaving one state and going into another, why is the receiving state completely unaware of her existence and the purpose of her being there? So that just shows right there that I literally had this visual of a piece of paper, like in some 1987 file cabinet in the back of someone's office, right? Like, it just, you know, it's all in who you ask, and they say, oh, well, it's the other guy's in charge. But another example I'll give you is that we had a child in the custody of a parent, and that the child was accepted into a program. And even though it was a private placement, the program's licensing required an ICPC. So we waited over 30 days only to find out that the child was denied because the sending state had concerns about the program that we chose. So I asked, well, what are your concerns? And to this day, we were never told. After many unanswered calls and emails, we just started over. And really, currently, there's no standardized process for appealing an ICPC denial. So states differ in their available options for appealing such denials, with some of them providing no clear avenue of recourse at all. So we just had to start over and just not choose that program. And so, and then another example I'll give you is that we found a placement for a child in a program, and she is in the custody of the state. And the ICPC was denied because the program was not on the approved list. Mm-hmm. So we found a second program, which, by the way, was denied because it was not on the approved list. So I asked, hey, can I see this approved list? And what's the process to add a program to it? And the caseworker actually laughed at me and said, you know what, your time would be better used to find something in state. So the child ended up back in foster care, and on the very first night jumped out a window, never to be seen again. I was never given the opportunity to find a safe placement for this child.
And I think that's, unfortunately all too common in these cases. I remember, gosh, this was probably, close to a decade ago when I was still a detective, and I was working a case, and we encountered two young ladies, 14 and 16 years old, in Virginia, and they had been involved in the foster care system in California. They had been groomed and manipulated by a trafficker, transported here to Virginia. And I remember it was so heartbreaking because we reached out to California. We said, listen, we found these two young ladies here in Virginia. And the first sort of response wasn't even like, are they okay? What do we need to do? It was take them and put them back on a plane to California. And when we had recovered them, it was in the middle of the night, 2:00 in the morning. And so there was a local program that would serve minors at the time. It was a great program. And so we had done an emergency intake, and got them placed. And so they were stable. And this was the next day. And I said, well, wait a minute, like they're in good placement. They're getting treatment. This is a specialized program for survivors of trafficking. And they were insistent that we take them to the airport, put them on a plane. And I flat out refused to do it. Not really understanding sort of the process here in the ICPC. I did subsequently receive a subpoena to appear in court in California to explain why I chose to not put them back on a plane. But it was interesting. It's just sort of my personal experience with what you were talking about, because it was a program that wasn't on this approved list, and all, even though it was the proper placement. Fortunately, in this case, the judge was willing to hear me out and agreed that they should stay in this program, especially because we were able to find some funding to support it. And I know a lot of times it does come down to the money question, right? And where they're sending money. But I think to your point, there's a lot of inconsistency between the states, right? Whether it's at what age does this apply to, or other factors around how they interpret or implement, ICPC. And so it can become really, really challenging. I think with regards to that coordination between some agencies. And you had mentioned in the beginning around how some agencies want to be involved, like they're willing to take these. But could you talk a little bit about what some of those barriers, those hurdles are for organizations that are serving minors that are willing to engage in the process?
I think they're just overwhelmed by not knowing who to call, and not knowing what form to fill out, and not having a guarantee that the placement will actually end up to be a successful placement. I think they're finding, as I'm finding, that each state seems to work in a silo. And so we often run into situations where the child is caught up in a debate of who has the last say, right? Like the sending state believes that they have the last say because they're funding the residential program. However, when additional funding is needed for supplemental treatment or travel, somehow it becomes the receiving state's financial burden, which, by the way, I hate that term, and I can't believe I just said that out loud. But I hear that phrase all the time, because that's how states consider these children a financial burden. I think if we maybe talked about them as if they were individuals, which they are, we would see improvements in the way that the cases are handled. But I think that the programs that are really nervous about entering into receiving children out of state, they see that there's no clear ownership and there's no clear path of communication, and that difficulty in communication, that I mentioned the obstacle from one state to another, but often that lack of communication happens within the state. And that sometimes is the delay, right? I've been on calls where advocates within a state are arguing on who's in charge here, right? And all I want is someone to sign the paper so that I can get this child to safety, and I can't seem to find someone to take ownership.
Well, and I think that's such an important part, right? Because we've talked a little bit about the funding component, right? And the paperwork and the policies. But at the center of all of that, kind of coming back to what we were originally talking about, is the well-being of a child, right? And I really love how, kind of framed it, said that they're a person in this process. And we know that somebody that's exited exploitation, that exited a trafficking situation, a lot of times there were risk factors in the beginning, right, that kind of opened that door, the vulnerabilities for the trafficker to exploit. They were exploited and experienced just horrific things. And now it's almost as if the system, the government, is not being responsive to the needs of the child. I wonder if you could talk a little bit about, from your perspective, from the well-being of the child, right? When we have these delays, when there's challenges in getting them into appropriate services, how does that impact the child?
It's horrible. I mean, their livelihood is at risk. Their survival is at risk. I think that when we often make it about money, right, and the decisions that we make do not benefit the child, and a lot of times what happens is, because, like I said, the states are working in silos, one state wants to keep the child in their state, similar to your example. Hey, this is a child in our state, we want to take care of this child, not realizing that they might have a specific need. And that specific need can easily be served in a different state, in a different program. And we have seen children elope and not return. We have a list of the children that we are serving, and we have a list of those that are currently missing. And unfortunately, this year we've had 2 that have passed away. It is truly crucial, for the sake of their livelihood, to get them in to a restorative care program that can meet their needs and do it quickly, because really it's the waiting that kills us, right? That's when we lose the child, when we're just sitting back. We don't have emergency safe housing in every state for children. And so when I get a call from law enforcement saying, I have a 14-year-old in the back seat, where can I bring her? Well, I have a beautiful place across state lines. However, I can't get her there tonight, right? It's a process. And so because of that, we end up compromising on their safety and security. And like I said, I mean, the clock is ticking. And if we can get judges and advocates to really collaborate and work together and understand that timing is everything, but also listening to the child and understanding the need is also so important, I think that we would make great improvements.
Yeah, I think, we're very fortunate to have some true champions in the space, right? There are some people that are really advocating for change. I know Sarah Poor out of Delaware, executive director of DATAC, is doing some incredible work with, statewide, to try to transform how this approach is really happening. But, the challenge is it really does take legislative change, it takes policy change, right? And so we need more champions to be able to stand up and advocate for this change that we need, right? I think one of the things that, when we look at what are some of the changes that need to happen, I think there's a need for standardization across states. And I wonder if you could comment on that a little bit, about how, if we were able to standardize that process, how it might make your job a little bit easier, and how it might make the process work better for these kids.
So it wouldn't be so overwhelming and time consuming, right? If we standardize the process, we wouldn't have the back and forth of one state trying to figure out the process of another state. I actually had one situation, I'll say real quickly. There was an individual child that I placed in a program that, while placed in the program and after a signed ICPC, She left the program to go into mental health stabilization in a different state. So long story why she did that, but she left that state, went to a different state to be stabilized. And then when she's getting ready to go back to the program, I simply said, do I need to start a new ICPC, or can I use the other one? Is it still active? And do you know the sending state and the receiving state argued about it for about 30 days on if the form was still valid. So I just created another one and initiated another one, and then was told I confused things because now there are two. And I'm like, come on, guys, like, can we not talk to each other? Can we not have some basic principles to follow, guidelines to follow, and have it nationwide, have one form, and then be able to have like clearer communication and better record keeping, by the way. I think that, of course, that would be a solid beginning.
Yeah, I think that's exactly right. Need for standardization, improving those communications and collaboration. And I think, the timeliness of it, right? Faster processing times through, because it's just paperwork. And unfortunately, I think one of the things, and I'll just sort of break from character for a second and just say that, one of the challenges, one of the big frustrations for me throughout the years working in this space has been, there are people that work this job 9 to 5, and there are people that work this job 24/7, 365, and I think that, Laura, I know your team is always, being responsive. They're always working past hours to try to do. We need more of that in this space, because again, this is not, we're not shipping out widgets. We're not stocking shelves at the local Walmart. These are kids that are being harmed because we're just taking our sweet time and not being responsive to this. And I think there needs to be more oversight.
Yes.
A lot of these.
Remember that the responsibility of that child's well-being, I think, rests on us. And that's you and I and everyone on this call. These children don't live with us. They don't live with me. They don't live with you. However, I believe that collectively they are our responsibility. Yeah. And so when someone in power is not advocating in the best interest of a child, they need to be held accountable. Like I remember a probation officer telling me, after knowing the gross detail of a child's abuse, told me that this child didn't deserve to be anywhere outside of lockdown. Shame on him, right? And that only made me and my team want to fight harder for her, to place her in a place that she could feel safe and to heal. But I think that, as you were saying, we need to have the attitude that these children belong to us, and that they aren't, like I said, a financial burden. Instead, they're our future. And everyone knows that the ugly numbers of children in foster care, right? I think last number I saw was that we have about 400,000 children in foster care in the US, and data shows that 20% of them will experience homelessness on the day they age out. I mean, surely we could do better.
I do, and I think that it goes back to the point we were discussing earlier, and that is, the impact, right? So these children have exited exploitation and should be on the path to restoration and healing, and yet they're continuing to fall victim. They're continuing to have to experience that lack of stabilization in their lives so that they can start to properly heal. And again, it's just, it's because sometimes we just look at them as a number, another case file coming across the desk. So again, it's a little bit of a sort of an emotional response to this, but I think that sometimes, we have to remember that, right? It can't just be all about the bureaucratic process or the dollar sign that gets placed in front of the cost of some of these things. And part of that is engaging the lawmakers and the policymakers, both at the state and the federal levels, right? So it's not just a state issue. This is a national one, and it's a place where, our federal government can certainly step in to try to align everyone on these different efforts, and to be able to push the reforms, ensure the protection of every child, really no matter where they are in the country. Laura, with regards to like some of the policy, right? We've talked about some of the paperwork and the timeliness. Are there other policies or other things that you feel we should be communicating to the lawmakers and the stakeholders to try to make this a priority, right? I do think the emotional piece is relevant, but let me go to a different sort of angle and say, if they want to look at it as a dollars and cents sort of problem, when we're extending out being able to place them, is that really even a fiscally responsible way to approach this issue?
State legislation. Instead, I just think of the kid, right? And I think that before me, I have a child that's neglected and abused, and that's physically, mentally, sexually. And I think, what can I do to let this child know that she's loved? And what can I do to let this child know that she deserves respect and that she has value? And I think first I do that by listening, like really listening and hearing what this child is saying and what environment that child would thrive in. And then I fight to get her there. And so what I would say to anyone that would balk at that, I'm depending on legislation and I'm depending on our judges and our law enforcement and our advocates to stand behind me, only because I'm doing it for the sake of the child. And that should be the driving force. And so, yes, I see what you mean. Like, well, it's not fiscally responsible. Well, I myself am a mom. I'm a mom. I have 3 kids. I've had to make decisions, because I live on a budget like we all do. But my decisions are based on the health and well-being of my family. And so I feel like it's the same way of thinking. And I've seen people do well in thinking that way, right?
Mhm.
Like, I've seen successes, right? We often throughout this call have talked about what's going wrong, but I have seen leaders stand up. I have seen judges work for the sake of the child. And public defenders that are willing to see the heart of the child as opposed to seeing a financial burden. I've seen states that work together with open communication. So you can't tell me it's not possible, because I've seen it in action. And quite frankly, 2 things that I always feel that is so important is, first of all, to give that child a seat at the table. When we allow children to be involved in their own recovery, it increases their chances of sticking with it. And many times their request for environment of recovery isn't any more expensive than the one that you chose, you being someone who's never met this child, right? And another thing that I think is important is having survivor leaders involved to advocate for the child. Just like when someone is struggling with addiction and they may have people surrounding them, giving them advice on how to get out of that struggle, it's not until they are approached by a recovered addict that says, hey, I've been there.
Mhm.
I know what that's like. And then you have a connection with someone that has a lived experience. And I believe that connection can move mountains. I don't think that these ideas cost any more money, because I'll tell you, Bill, sometimes we get turned down for a placement opportunity and that child is then put in behavioral health,
Mm.
which, by the way, is not offering any sort of restorative care. And I don't have the numbers before me, but I'm going to guess that full-time behavioral health facility is going to cost way more than the group home that I had suggested she live in. So really, like, when I say they want to make their decisions about money, I feel like in some situations we could save them money.
And I think that's, it's a good point. I mean, your position is very well taken, that this is something that it shouldn't be about the dollars and cents, right? It should be about the well-being of the child. And I think, many people get involved in this space. And I do want to just take this because I don't want, if there are folks listening in today that work in this space, that work for DFS and other groups, I don't want them to feel like they're getting beat up on necessarily, right? The reality is we know that they're working within the constraints in which they're provided. And I think another thing, it's sort of off topic, but related, is that I also think that within this space, particularly those government agencies that are working for the protection of children, there's really a lack of like self-care and trauma-informed training for these individuals. And I think that sometimes we leave some of these frontline professionals defenseless to really be able to respond the right way. So I just wanted to kind of to highlight that particular piece of it. I know there was a question around ICPC and unaccompanied minors in the US. And to the best of my knowledge, ICPC does not apply to unaccompanied minors because they're under the purview of the federal government. So it's a different sort of system in the way that those individuals are placed into restorative care facilities. And I did certainly that was sort of a one-off. So I didn't know, Laura, if you had any experience with that yet in the work that you all are doing. But is it, if you know, if it's a different, or what that process looks like for unaccompanied minors?
Yeah, that's a really good question. It seems that the more I try to learn about the immigration process, the more confused I am. And so one thing that I have learned is to just stay in my own lane. And I am not trying to be an expert in immigration. I just know that I need to surround myself with those experts so that I know who to call. We have people in every single state that is well versed in those individuals' rights and what options we have before us. And so those are the people that we lean on. The children that we have placed unaccompanied minors in the past, and we have placed two, we ended up placing them within the state that they were in. So I actually don't have any experience of trying to place them outside. I was told it wouldn't be a problem, but that was all I was told, is that it wouldn't be a problem. So I wouldn't actually know the actual administrative process for that.
And that, again, I think it goes back to just how complex and how confusing the system is for individuals to be able to properly navigate that. And so I think in these last couple of minutes, I just want to say, well, how do we bring about change, right? And I think the reality is we've heard some really good ideas, but I think at the end of the day, there needs to be more awareness for lawmakers, policymakers. I think oftentimes there's a disconnect between those that are implementing policy and those that are running different agencies that are responsible for the protection and welfare of children. And
Yes.
Those that are working in the field, like your team, Laura, and they're, so I know Safe House Project has been doing quite a bit of really incredible work in the policy space, both at the federal and state and local levels to try to inform on some of these different pieces. But one of the things that I just want to highlight from that policy perspective is it really does take collective action, right? It is about all of us really coming together. I know someone put in the comments about who needs to be at the table. I think it's a really valuable question. I think, Laura, you've answered some of that today, right? Survivor advocates absolutely need to be at the table. The child needs to be at the table if it's particular to their case. But I want to kind of challenge everyone and say, I don't even know that we have a table yet to sit around. And I think that this is something where within each of our states, we would challenge individuals to become champions of this cause, to really look at it, to not be deterred by the complexities or the confusing nature of it, but start to figure out, okay, who does need to be around the table, and start to convene and have the conversations, and then start to advocate. Safe House Project stands ready to assist in any way in supporting, whether it's talking to Laura's team about practical implications of it, or pinging the policy team to really understand how do we navigate some of these spaces. But these reforms are not going to happen overnight. But if we start to, push for standardization, improving communication, holding states accountable, I think that we truly can create a system that does truly protect children. Laura mentioned that, she's seen some great successes in everything that's happening. And In these last 2 minutes, Laura, I wonder if you could give us a story of hope, a success story that you've seen where a child has been able to access relevant services and the system to some degree worked for them.
Absolutely. Gosh, I have so many. One I guess I'll highlight is one that when the case came to us, she was in the hospital and seriously beaten and sexually abused and addicted to many things. She was behind in school, and everyone around her was just really pushing her down, not motivating her to try anymore. Her dad was in prison. Mom didn't care. I think mom ended up losing custody. So it was just a nightmare. It really was. And so thankfully, she had a caseworker. And I love that you called that out earlier, Bill, because I never want to say anything against these caseworkers who, by the way, are overworked and underpaid for sure. But she had a caseworker that really fought for her and said, we need to think outside the box. I don't have time to go through all of the challenges, but let's just say she had a lot of challenges to place her. And so what we did as a team, we ended up getting together on several of our programs. We talked about the environment that she needs, the environment that she wants, and then we just talked through that with the child. She ended up going to the program, starting off behind in school, ended up graduating early. She ended up graduating from the program and now in transitional housing that we helped her get into. And now she's going to college. She started in August. She wants to be a nurse. And so when I hear stories like this, I know that it's real, right? And I have other stories as well, right, of children that have had horrific beginnings and horrible abuse, but then they were able to get into a program and allowed to really thrive. I end up getting that beautiful feedback. One girl told me, she says, and she's only 14 years old, she says, I really love it here, Laura. I want to stay until I'm 18. And I said, well, what do you love about the program? And she says, I'm doing good in math. And she says, I was failing math before, and now I'm doing good in math. And of course, there's a long list of things I thought she would say, but really clearly it means that she wants to succeed, right? She wants to do well in math. She wants to do well in school and just never had the opportunity to do so. And so I could go on and on about beautiful stories that we have had the opportunity to walk alongside these survivors in those successes. And it just gives all of us hope. It gives us hope to know that really it can be achieved, right? Otherwise, we wouldn't be going through all of this, right? If we didn't think that these restorative care programs worked, we wouldn't be jumping through hoops and over hurdles trying to get them there. But I truly believe that we have a long list of success stories that we can hold on to.
Well, thank you. And I want to thank everyone for being a part of today's discussion. I hope that you leave really feeling not only informed, but really hopefully inspired to take action, right? And Laura's story of hope, like she said, there's so many of them that are out there. Oftentimes we focus on what's not working, but I think it is important to balance with what is working, right? Because that's where we start to find the real solutions. And at the core of it, the children being affected by these systemic failures deserve our attention, our effort. They deserve our commitment to ensuring their safety and well-being because, as Laura mentioned, they are people, right? They are individuals. Maybe they just want to succeed in math, which I think is so cool, right? That Laura, I want to thank you for your incredible insights, for all the work that you and your team do at the Safe House Project to connect survivors to relevant services. I know that if we come together, we will drive the changes needed to create a safer future for children everywhere. I know the sort of the tagline, the vision that I've held on to for all of these years is really envisioning a world where all children are able to achieve their full potential without the threat of being trafficked or exploited. And knowing that your team is helping to make that happen. So I hope everyone continues to push forward. We continue to advocate. We continue to work together to ensure that no child is left behind because of some of these short failings of our system. So thank you all for being here today.
Thank you, Bill.